This webinar is the second part of the lecture that covers the regulation of cardiac output and venous return. It is somewhat of a standalone lecture. We're going to be looking at exercise and different types of exercise, different severities of exercise, and the effects on the cardiac output and blood pressure. And the scenario here is it's a special case scenario where the nervous system is going to play a very important role, and particularly it's going to play an important role in the maintenance of blood pressure. What you would think would happen is when local tissues, the blood vessels and local tissues dilate and attempt to increase blood flow to those tissues, that could result in a significant drop in blood pressure. But the mean arterial pressure is not going to drop as much as you think it would because of the role of the nervous system. But we're going to look at different types of exercise and whether or not that blood pressure changes or not. But this is a kind of a really good example of looking at the role of the sympathetic nervous system in exercise. But we'll also kind of look at the role of metabolism and temperature regulation in different types of exercise. But before we kind of go over what's in your notes, I want to kind of go big overview, big picture type stuff. When you think exercise, you should associate with a mass sympathetic response. You've got nervous innervation of various tissues. It's going to affect the vasculature. It's going to affect the heart. But you also have the sympathetics affecting the release of the catecholamines norepinephrine and epinephrine from the adrenal medulla, which also will affect various organs as long as the receptor is present. So think about what do you expect to happen or may happen when you're exercising. Heart rate and contractility. You're like, okay, I would expect my heart rate to go up, an increase in cardiac contractility to help stroke volume. So that's what you're expecting. How is that going to happen? What would you want to happen to flow to various tissue beds? Well, you want an increased flow to the working muscles. You want to make sure you have enough flow to the lungs and the heart. Other tissues, you don't want as much flow. You want to divert flow from one tissue bed to the other. So when you look at resistance, what's going to happen to resistance? If you think mass sympathetic response, you're going to start thinking an increase in resistance. So you're going to constrict various vessels, but in the tissue beds that are working, you're not going to have that increased resistance. You're going to have an overall drop in resistance. But remember, where you're going to have the drop in resistance is going to be locally controlled. So it's going to be under the control of local factors and not the nervous system. Mean arterial pressure. You want to be able to maintain mean arterial pressure even where you have vasodilation and a drop in resistance in some places. So you want to make sure mean arterial pressure stays adequate. So we're going to start first with isotonic exercise. Isotonic exercise is also referred to as dynamic exercise. So think of it as like I'm walking, I'm running, I'm cycling. You're not maintaining a contraction when you do an isotonic exercise. You can lift weights, and you can lift weights isotonically. So if I'm actually lifting up the weight, that is an isotonic exercise. When you look at isotonic exercise in blood flow to the working muscles, here's a picture that demonstrates the type of blood flow you're going to get during isotonic exercise. You'll notice that it's intermittent. It increases, decreases, increases, decreases. The reasons why you see intermittent flow is you'll have an increased flow, but while the muscle's contracting, there will be, because of external compression, you won't have flow, but it doesn't last that long. So overall, flow is going to increase depending on the level of exercise, but it is intermittent. It's not, I should say, it's not non-existent. So you will have flow, but they can call it intermittent flow. Overall, when you think isotonic exercise or any exercise, it is a mass sympathetic response. But we are going to look at two types of exercise. In our first type of exercise, it is completely a mass sympathetic response. In the other level of exercise, you're going to see the role of temperature regulation and metabolism in what we see, the overall effects on blood pressure, and the role of those factors on blood pressure itself. So what we're going to do first is I'm going to look at moderate exercise. So in lab, moderate exercise, or isotonic exercise, I should say, is you're going to be riding a bike, okay, stationary bike. Now, moderate exercise, it's very easy. This is not very intense at all. So our definition for moderate level of exercise is just a 40% increase from your baseline heart rate. So if your heart rate is 80 beats per minute, how you would determine what your target heart rate for in lab is you take that 80, you multiply by 1.4, that will give you a 40% increase in heart rate, and that will be your target. It will not take much to get there. So it's just kind of a really lazy ride in the park type thing. So what do you expect to happen during moderate isotonic exercise? So heart, what would be the effects? This is the mass sympathetic response. What do you expect to happen in the heart in regards to cardiac output? Well, cardiac output would increase because you expect heart rate to go up and you expect contractility to go up, which would increase stroke volume. So you expect cardiac output to go up. Venous return. Well, if cardiac output's up, venous return should go up because venous return does control cardiac output. So venous return is also increased. Now these are determined by the level of metabolism. Now the peripheral circulation. Now look, I say arteries. I didn't say arterioles. Arteries, what do you expect to happen in the peripheral circulation? Now this is a mass sympathetic response. You're going to get vasoconstriction. So resistance in the arteries will increase. Also in the veins, resistance will increase. So another term for me to say what's happening in the veins is venoconstriction, V-E-N-O, constriction. So you'll get constriction in the arteries, you'll get constriction in the veins, overall resistance will increase. Now why would you have constriction in the veins? Well, you're going to get constriction in the veins because you're going to be borrowing some blood to help to increase venous return. So overall, total peripheral resistance will increase with moderate isotonic exercise. Now I'm well aware that at the level of the working muscles, you'll have a drop in resistance, but the arteries will not be dilated. You're going to be looking at metarterioles, the precapillary sphincters, maybe the arterioles right before those metarterioles, and that will be controlled because of local factors. But overall resistance is increased with isotonic exercise, in particular here, moderate isotonic exercise. So what would you expect to occur to your blood pressure? So let's look at the effects on blood pressure. Think of systolic blood pressures as being determined by the pump, the heart. Diastolic blood pressures are determined by drainage. That's like the plumbing. How fast is that blood being taken away from the heart? That will determine your diastolic blood pressure. So when you think about the pump, what do you think is going to happen to systolic blood pressure? You would expect that systolic blood pressure goes up, and it will. The diastolic blood pressure. Here, diastolic blood pressure may seem kind of odd. Believe it or not, diastolic blood pressures may not change very much, if at all. You may see some people's diastolic blood pressures go up, but a little. You may see them go down a little, but it does not change significantly. So it may or may not change, often doesn't change very much. So I have kind of the line going back and forth. It doesn't change a huge amount. Now pulse pressure. Pulse pressure is the difference between your systolic and diastolic blood pressure. If the systolic goes up, the diastolic doesn't change that much, what would you expect to happen to pulse pressure? It's going to increase. Okay, so pulse pressure will go up. And how you could figure that out, besides me telling you what someone's blood pressure is, if you feel that person's pulse, how it feels, it's going to be very strong while they're doing that exercise. Now, mean arterial pressure, because you'll notice that diastolic doesn't change that much, the mean arterial pressure will only change slightly, if at all. So when we do this in lab, you're going to notice that mean arterial pressure will not change that significantly. The reason why it doesn't change what you would think it would is because of the peripheral vasodilation that's facilitating flow to muscles. So you're not going to, mean arterial pressure is not going to change all that much. Now, when I ask you to do severe isotonic exercise, we're going to bring it up a notch. Now, severe isotonic exercise, what you're going to do, it's going to be a 65 to 85% of your heart rate max. Now, we will estimate what would be considered your maximum heart rate. So 220 minus your age will be our estimate of your max heart rate. And your goal is to do 65, 75, or 85% of that max heart rate. If you're a couch potato, you're going for 65%. If you're an athlete that works out pretty consistently during the week, you're doing this type of exercise, you can go for 85. If you're somewhere in between, you're going for 75. Okay, safety is first. Do not try to do 85% if you're not used to it, because you will get sick or you will pass out. Okay, we have seen that in labs since I've started. We've had people pass out, we've had people had seizures, and we've also had people that have thrown up. So we are trying to be as safe as you possibly can. Now, when you do severe level of exercise, it is a mass sympathetic response. Now, initially, and at a certain point, you may see the effects of temperature regulation or thermal regulation, and the effects of a huge increase in metabolism. So we're going to see what you would expect to see if you start to get the effects of temperature regulation and a huge increase in metabolism, which may happen with severe isotonic exercise. So when you look at the heart, when you're doing severe isotonic exercise, what do you expect to happen with cardiac output and venous return? It should be exactly what you expected to see with moderate. Both will increase, but they'll be even higher than you saw with moderate. Okay, so it's going to be increased heart rate, increased contractility, all that's going to happen just even more than you saw with moderate. When you look at the peripheral circulation, you still are going to have an increased resistance. You're going to constrict arteries. You're going to also have venoconstriction, again, barring blood. So you still expect to see this, and overall, initially, you'll have an increase in resistance, total peripheral resistance. But what if you start getting too warm? What if you've got so much blood flow to those skeletal muscles? You've got maximum vasodilation in skeletal muscles. What would ultimately happen? So, if you have the effects of temperature regulation, you're getting too warm, resistance in the skin will decrease. Okay, so what you expect to happen when you're just doing moderate exercise, and we did this in an earlier lab, is you had constriction to the skin when you're doing those crunches in lab, because you're diverting the blood away from where you don't need it to where you need it. But if you get hot, good way to cool off is to increase blood flow to the skin, and you'll get vasodilation to the skin, and resistance in the skin will decrease. If you also have maximum dilation in skeletal muscle, you've got so much muscle, so much blood flow, what can happen is overall total peripheral resistance may drop very significantly. So if you've got kind of combination of temperature regulation and massive metabolism, resistance may drop very significantly. Now, one thing I do want to mention is that in athletes with very high vascularity, they can have so much increase in cardiac output or they may need a huge increase in cardiac output to get blood to those working muscles. They may get to a level that they keep vasoconstricting to the skin and they won't cool, and so they can easily overheat. So that actually may happen with some of these elite athletes. Now, what do you expect to happen to blood pressure with this type of exercise when it's severe? Again, systolic is about the pump. So with systolic blood pressure, you expect it to go up, and again, it's going to be higher than what you'd expect with moderate. Now, diastolic may actually, if you start seeing the effects of temperature regulation and the effects of that metabolism, diastolic may not, diastolic may not change that much, or with the case where I mentioned where we've got massive temperature regulation and metabolism, diastolic blood pressure may actually drop. So I want to explain why it may drop. Some of you, generally, we're only going to see this mainly significantly in those people who are going about the 85% max. Lots of times it doesn't change that much, even with severe, but some people it may drop significantly. So think about, again, it's about the drainage. If blood is draining from the heart very quickly, the pressures being measured in the aorta, which represents your diastolic pressure, may drop because you're moving the blood away too fast. And it's that blood in the aorta that's determining the pressure. And so if you're moving it away from the heart very quickly, diastolic blood pressures may drop and may be very significant. And we have seen that where it's extremely significant in some people during lab. Now, what would happen to pulse pressure? If systolic's going up and diastolics are dropping, definitely pulse pressure will be increased. So it'll be even more than you saw with moderate. But what about mean arterial pressure? So you notice mean arterial pressure, you can get a significant drop in diastolic blood pressure. So mean arterial pressure may drop in those instances. If you have someone whose diastolic pressure is not changing that much, the mean arterial pressure may not change as significantly. So overall, with severe isotonic exercise, mean arterial pressure may not change all that significantly, even though you're at a high level of exercise, but it may actually drop because of that drop in diastolic blood pressure. The other type of exercise that we're going to do is isometric exercise, which is also referred to as static exercise. So you'll notice here we're looking at blood flow, that during an isometric exercise, you have little to no blood flow in those muscles. Following the exercise, you may have a higher than normal level of blood flow, but you're not doing the exercise anymore. That would be, over here would be an example of reactive hyperemia. Now, so why do you have little to no blood flow during the exercise? When you're doing an isometric exercise, you're going to have mechanical constriction of those vessels. And you are going to have a mass sympathetic response, but it's going to be exaggerated. What happens is during the exercise, the information is going up to the vasomotor center, and it's coming from muscle tension. So where you're actually constricting the muscle or contracting the muscle, sending information up the vasomotor center, and you're going to have a mass sympathetic response, constriction or increased resistance, increased blood pressure, increased cardiac output. And you think, well, why would that happen? It's an exaggerated response. Now, if you're having little to no blood flow to a vessel, you're like, I can't change resistance because I'm mechanically compressing it. Only way I could probably increase blood flow is to increase blood pressure significantly to try to force blood through those vessels. Thing, though, to keep in mind, if you do an isometric exercise, you cannot hold a max isometric exercise or a peak isometric exercise very long, okay? So generally, and this shouldn't mean down here should not be in minutes, because you cannot do isometric exercise for 30 minutes. So it's usually less than a minute that we're going to be able to do an isometric exercise. So isometric exercises cannot be done for very long, because without that blood flow, you're going to have some issues, okay? But what we're going to see is the effects of this pressure response that's coming from muscle tension. So this is very important for me to tell you now. While you're in lab doing an isometric exercise, You must take all of your measurements during the exercise and not after, because if you're not doing the exercise, you will not see the response. So what we're going to do for moderate is you're going to have two things that we can have you do. You can squeeze a hand dynamometer at a certain force that you can hold for about a minute, but nothing too easy. It's got to be about 80–90% of what your max pull that you could have gotten in the hand dynamometer. Or some of us are going to have you do this, use this little forearm grip exercise. You're going to squeeze it and hold. So you have to squeeze and hold and maintain it. Nothing too much though that you're going to start kind of getting fatigued and let go and squeeze, let go, squeeze, because that's not isometric, that's isotonic. So you're going to maintain the squeeze. So what's going to happen, what you expect to see with moderate isometric exercise, it's a mass sympathetic response. It's slightly exaggerated. Cardiac output and venous return, you expect both to increase. Okay? Peripheral circulation, you expect both the arteries and the veins to constrict. So you get constriction of arteries and veins. Overall, total peripheral resistance will increase while you're doing the moderate isometric exercise. But what about the blood pressure? Okay. Systolic is about the pump, so if your cardiac output's going up, I expect systolic to go up, and it will. Okay. Diastolic, remember, that's all about the drainage. If you've got little to no flow going to those muscles, blood's going to be sitting there. So diastolic blood pressures are going to increase, and they will. So systolic and diastolic blood pressures will increase during isometric exercise. Now, if these both go up, pulse pressure will not change. So I will know in lab whether or not you really did an isometric exercise. If your data indicates your pulse pressure went up, I know you didn't maintain that contraction. It was too much for you and you were letting go and squeeze and let go, squeeze and let go. Pulse pressure should not change if you're doing an isometric exercise. Now, if systolic and diastolic both go up, mean arterial pressure will go up. So mean arterial pressure does go up during moderate isometric exercise. For severe, not everybody in lab will do this, or not every group will do this. We'll pick maybe 2 people from the lab to do severe exercise. So how we're going to constitute severe is we're going to use a larger amount of muscles or a larger muscle group. So before, you're just going to do forearms, not a lot of muscles involved. Here, we're going to do a static squat. So we have over here, this is the machine that you'll be using. We call it Big Blue. And you're going to put, like this guy here, put your shoulders underneath the padding. And we have some hydraulic, it's a hydraulic system, is that you're going to lift. And as you lift, you're going to feel that tension. You lift and then hold it. So you're going to hold something that you can hold probably less than a minute, as quick as we can take your blood pressure. You're going to be hooked up to the BioPack. You're going to have the pulse pressure transducer on you, but unlike what this guy is doing, he's got his hands up here. You will keep your hands to the side. We don't want you to put your hands up because that's going to exaggerate the response. Plus, we need to have that pulse pressure recording be fairly accurate. So you're going to keep your hands down to the side. So you're going to do a static squat. When you do severe exercise, isometric, both cardiac output and venous return will go up even more than you saw with moderate. You're going to have resistance increase, again, in the peripheral circulation, even more than what you saw with moderate. So overall, total peripheral resistance will go up. Blood pressures. Systolic is going to go up more than you saw with moderate because your cardiac output, your heart rate is going to go up even more. Your diastolic blood pressure is going to go up also. Blood not going anywhere. You've got that mechanical compression through those blood vessels. Diastolic is going to increase even more than you saw with moderate. Pulse pressure, again, though, will not change because these both are going up. Same percentage increase. So this will not change. What you'll see because of the increase in systolic and diastolic is mean arterial pressure can go up quite significantly depending on how much you decide to lift and hold and maintain. because I have seen quite large increases in mean arterial pressure. But your goal is not to lift as much, there's not a competition who can lift the most, because I could care less what you're lifting, but you have to be able to maintain the lift. So if you try to lift too much, you will not be able to maintain it, and you will do an isotonic exercise. And I'm either going to tell you try again, or I'm going to have to switch to another person, because I need to see isometric exercise. So when you compare blood pressure responses with isotonic and isometric, this is how it looks. The top in red is what you expect to see with isotonic. Systolic blood pressures go up as the severity of exercise goes up. Diastolic don't change all that much. You can see it goes up maybe a little bit here. It may not change that much, and if anything, diastolics can drop. But some people, it's not going to change that much. Mean arterial pressure is going to mimic kind of what you see with the diastolic. It's not going to change drastically, unless perhaps with severe it may drop. So if you see a drop in mean arterial pressure, I guarantee you they did not do an isometric. It had to have been an isotonic exercise. So this is what you expect to see. On the bottom is what you expect to see with isometric exercise. You'll see systolic, diastolic, and mean arterial pressure both go up. Now if you want to look at pulse pressure, remember pulse pressure is the difference between systolic and diastolic. Isotonic, it's always increased. With isometric, it's the same. It stays the same. So this is what we expect to see, and we will see during lab when you do isotonic and isometric exercise. So I have a clinical question to ask you. If you have a patient who's got documented high blood pressure, or a patient with documented heart disease, which exercise will you prescribe to that patient? Would you say do isotonic or do isometric exercise? So you're going to think about, well, which type of exercise is going to place the most load or stress on the heart, and you're going to say, I'm not going to pick that one. You want the one that's not going to stress the heart as much. So you should pick isotonic over isometric exercise, because isotonic exercise, the mean arterial pressure doesn't go up as significantly, if at all, than when you see with isometric. So if mean arterial pressure, specifically if I talk about the diastolic blood pressure, that goes up, the heart would have to work harder to get blood out of the heart. So that's not a good choice. And I specifically, though, would recommend for people with high blood pressure or with heart disease, choose moderate, since that places the least amount of stress on the heart. Because severe, obviously the heart would have to pump a lot more just to get all that blood out. So I would pick a moderate level of exercise.